My name is Gregor McNeil. I'm an acute medicine and critical care consultant at NUH. One of the most important tasks you have as a doctor is to recognize when one of your patients starts to get sicker. We know from our own and from national data that even today there can be a delay in patients getting the escalation in care they need. The longer patients are allowed to deteriorate on the ward without intervention, the greater their chance of further worsening organ failure and death. Tragically, even today, patients still die because a junior doctor failed to escalate to a senior. Every NHS hospital now uses an early warning score, or EWS system, to ensure sick patients are recognised and escalated in a timely manner. Here at NUH, we use our own NUH-specific EWS system. There is a separate scoring system for paediatrics called PEWS and obstetrics called MEWS. In common with other EWS systems, at NUH a score is assigned to a number of observations parameters. As the patient gets sicker, the score rises. Once the score rises above a certain level, this triggers a nursing, critical care outreach team and medical response. The mandated escalation response is outlined on every observation chart. You must be familiar with your role within this pathway. There are 3 levels of medical response for adult patients. First, the patient is becoming sick. The EWS has been 3 for the past 2 hours. Once the score has been 3 for 2 hours, or there is other clinical concern, you will be contacted to review the patient. You must review the patient within 60 minutes of that score, and you must document and time your review in the medical notes. The patient is deteriorating further. The EWS is now between 4 and 5. Once the patient has become this unwell, you must review the patient within 30 minutes of the trigger. You must document and time your management plan in the notes. Crucially, you must then immediately discuss the management plan with your supervising registrar or consultant. Whether the supervising registrar is resident or on call from home, whether it is the middle of the day or the middle of the night. The patient is now becoming critically ill. The EWS is now 6 or above. Once the patient has an EWS of 6 or above, they are by definition critically ill. Any delay in treatment could result in cardiac arrest. You must review the patient within 30 minutes of the score, and you must request an urgent registrar review. Arterial blood gas sampling and high concentration oxygen should be considered. The management plan must be documented in the medical notes. Crucially, the management plan must always be discussed with the supervising consultant at the time of deterioration, whether it is the middle of the day or the middle of the night. This discussion must be documented in the medical notes. At this time, your consultant will consider whether referral to critical care is required. These are the key features of our adult escalation pathway. Please note the pediatric PEWS score and escalation pathway will be covered in your local pediatric induction. The escalation pathway may appear daunting, but remember support is available. In parallel with your response, staff must notify the Critical Care Outreach Team, or CCOT, of all patients either causing concern or with an EWS of 4 or above. CCOT currently operate between 8 a.m. and 10 p.m. every day. Outside these hours, the critical care medical team are always available. CCOT have huge critical care experience and will support you and the ward staff managing the deteriorating patient. Also, remember any referral you make within the escalation pathway can be made more effective and safer if you use a standardized method of communication, such as SBAR. Remember, situation, state your name and the problem you are calling about. Background, state the admission diagnosis and date, background to the current problem, and other relevant comorbidity. mention the relevant treatments so far. Assessment. State your assessment including A, B, C, D, E and the EWS score. Recommendation. I think the problem is this. State what you would like to see done. Determine timescales. Is there anything else I should do? SBAR prompts are available on all wards, and additional information is on the Trust intranet. If you have any feedback regarding any aspect of the EWS system, please feel free to contact the NUH, EWS and PEWS education team. Remember, you must follow the NUH EWS escalation pathway without exception every time you see a deteriorating patient. The escalation of deteriorating patients admitted to critical care is now audited, and any deviation from the above protocol is fed back to you and your consultant. So remember, an EWS of 3, review within 60 minutes. An EWS of 4 or more, review within 30 minutes. EWS of 4 to 5, you must discuss with the registrar or above. EWS of 6 or above, you must get an urgent registrar review. The case must be discussed with your consultant. Thank you.